Hi friends and subscribers. In today's video I will be talking about how we can increase our IVF success on the very first attempt. In today's video I will be talking about certain key secrets that I use in my day-to-day practice in trying to increase the success rate of IVF and give you a success in the very first attempt. So let us go step by step. My name is Dr. Mayur Pai and I am a practicing IVF specialist in Goa in India. You can get my contact in the description below. So first of all, I would like to thank all my subscribers who have helped me cross the 600 subscriber barrier, and very much thankful to all of you. Through the various phone calls and tele consultation that I have done with various patients of mine, I have realized that many of them keep asking the question how to increase the IVF success on their very first attempt. Well, this is the video for all of them. Let me go step by step in how we do it in our practice. A small disclaimer: what I do in my practice suits me and has been giving me amazing success rates in so many years. It may not suit each and every IVF practitioner in their locality with their patients. So what suits me may or may not suit you or your patients. So let us begin. First of all, in our IVF practice, it is very important to go in detail. One very important thing is perfection. Perfection is defined as many small things done perfectly. That will give you the good success rate that you want to achieve. Mostly when the couple walks in, they are very much stressed. Sometimes their diagnosis, I would say mostly their diagnosis is not certain, as in the wife doesn't know what is the reason why she is not conceiving, and the husband also doesn't have a perfect idea of why the conception is not taking place. So first we go into the details of the wife and the husband. The first or the initial consultation sessions, that is when the couple comes in and visits the IVF clinic, it may take almost 2 to 3 hours of discussion and certain testing that the wife and the husband has to undergo. The wife has to undergo a detailed ultrasound screening done on a good machine, which gives you a very in-depth idea about how the lady's uterus is, how the endometrial lining is. By saying the uterus, I would also like to look for evidences of fibroids, adenomyosis, endometriosis, or any pelvic infection or inflammation. We cannot look at the fallopian tubes on an ultrasound. However, diseased or enlarged fallopian tubes can be easily identified by a high-end ultrasound machine. Definitely the doctor or the sonographer should be very well trained in identifying these conditions, and that is something which is very important. In our ultrasound center, I do the scans myself, and sometimes it is done by my trained specialist who is highly trained in ultrasonography for infertility causes. Also, in the same ultrasound, we have to go into the ovaries as well. We have to look into minor details like what is the size of the ovary, how many eggs each ovary contains, also the location of the ovaries, and any other abnormal findings with the ovaries, let us say like cysts, chocolate cyst, which is also called endometriosis of the ovary. We might get an abnormally shaped ovary. You may get something called polycystic ovaries, that is abnormal enlargement with abnormal number of follicles and quality of the follicles. And sometimes you get very tiny ovaries which are close to the atrophy, that is I can say simply an ovary which has aged prematurely. We get various of these findings, and sometimes the ovary is involved in a pelvic infection or inflammation, and the ovary may be stuck to certain organs, maybe sometimes stuck to the uterus itself, or maybe stuck to the abdominal wall or any other place. This causes the ovary to have an abnormal location. Well, these are the different findings that I am just basically covering in the early screening of the IVF patient, that is the woman. Then definitely, as we have gone in great detail of the woman, we have to go in great detail of the man also. We go into details of the sperm, the semen analysis, we do a semen wash test, we go greatly into details about how the sperm count is, the motility, and how the morphology of the sperm sample is. It is very important to go into the details of all these things right at the start, because as you must have seen in the video which is covering IVF failures, all that we are trying to do is exclude the different causes of recurrent IVF failures or IVF failures to begin with. If at all we are taking a couple on board and taking them ahead in their IVF journey, it is important that the couple, that is the woman and the man, should completely understand what all are the chances of success right at the start. So also, if in case we identified certain factors in their let us say the eggs, the uterus, or the sperms, we have to try our best to correct it as well. We give them the best therapy which is known as per the modern medicine to cure the certain diseases which may have been identified right at the start. Some diseases require some injections, some tablets or something like that, and certain diseases are cured only by surgeries. In my IVF center, I perform all the surgeries of laparoscopy or hysteroscopy on my own, so that I know exactly what I am looking for as an end result at the end of the surgery. So we call these surgeries preparation for IVF, as in the woman is made much more fertile than before. These surgeries can also be called as fertility enhancing surgeries. Followed by this detailed analysis of the woman and man, we tell them the different treatment options that they are looking at. Also, along with the different treatment options, it is very important to explain the different chances of success, that is the prognosis, as well as the different costs associated with the different treatment options. Based on that, the couple has certain goals. The couple will totally be in a position to give an informed idea or an informed consent about what they want to go ahead with. Some of them want to go ahead with IVF, some of them want to go ahead with IUI, sometimes they want donor sperm, sometimes they want donor eggs, and sometimes surrogacy is the best option that is left to them. Of course, with the different choices comes different success rates and different costs. These are all explained to the couple, and what I would like to stress on is that at this very important point, the couple should make a very important decision about how they want to go ahead. If their choice is non-scientific or non-ideal, as in if at all the right choice for the couple, let us for an example say, if the right choice for the couple is to go for donor eggs and she opts for her own eggs and is not willing to invest enough in her own eggs, that is not enough to pump in enough money to buy the better medicines or the better treatment protocols in going ahead with her own eggs, she may be ending up doing a substandard IVF or a non-ideal IVF. So hence the results may be poor. It is at this point we do inform the couple about what all choices and what all mistakes in the choices that they are making. However, the end choice is always with the couple itself. Definitely non-standard treatment protocol, let us say things like polycystic ovarian stimulation, things like double stimulation or dual stimulation, that is luteal phase stimulation, or low dose protocols which involves a lot of freezing and thawing. All these protocols which are non-standard protocols are definitely much more expensive than the standard protocols, and also they are often done in couples who have poor prognosis to begin with. So do not expect a very high success rate in them, which you can expect in a young couple or a couple who is, let us say, sub 35. So this is as far as the patient part is concerned, as far as increasing the IVF success. Now let us talk about the IVF itself. Definitely in our setup, we go to great lengths to make sure that the IVF is done in the most standard and internationally accepted method as possible. We use the best anesthetic agents which are proved to be the most safest in a case of IVF. They are mostly inhalational and injectable agents that give us around 5 to 10 minutes of good anesthesia, which is very painless, pain free to the patient, as well as very comfortable for the doctor. When this sort of an anesthesia is used, we make sure that the damage done to the oocytes is the most minimum that is there. We have to take great care that the DNA inside or the genetics inside the oocyte or the egg is protected as much as possible from any medicine that we may be using. A to Z, all injections and all medications used in IVF should be IVF friendly. That means that the eggs should be of as good quality as possible. I will not go into the technical details of this because this is a very simple and patient oriented video, and I don't want to make it technically challenging for the patient to understand. Followed by that, we have to do a very good IVF, that is the transvaginal oocyte aspiration. We have to try to get as many follicles as possible, as safely as possible. Once we do that, we'll have to go ahead with the embryology details. In the embryology lab, the main purpose of the embryology lab is the combination of the sperm and the egg. The sperms and eggs are handled in the IVF lab under a very controlled environment. Now, what do we mean by controlled environment? A controlled environment means that right from the air that is there in the IVF lab, every other surface and all the other things like even the temperature of the air is completely controlled. The air is sterilized and double sterilized. That means it is cleaned and cleaned further up to even 3 times till it reaches the embryology lab. So it is very important that the IVF setup is not just a basic setup having the bare minimum equipment, but it should have at least the adherence to international protocols, so that the smallest and the finest details of embryology should be taken care of. So right from the air that the oocytes and the sperms are exposed to all the surfaces should be clean and genetic friendly. That means there should be absolutely no DNA damage caused by them. Also, the light that enters the IVF lab should be as minimal as possible, so that we get the best culture environments for the babies. Also, the incubators, the way they are to be used, it should be as per the manufacturer's protocols. It is no point in crowding the embryos into a single small incubator, because definitely the DNA damage, the damage to the environment in which the different embryos are will be quite a lot. In our center, we prefer not to batch up the cases. Now, what is this thing called batching? In various centers, due to certain logistical reasons, or maybe since the doctor is coming from a faraway place or the embryologist is coming from a faraway place, they tend to batch up the patients. That means almost close to 7 to 10 patients may be coming and doing their IVF on one particular day. Now what happens is, all the samples which will be processed on that very day will be processed back to back. As a result of that, there will be a lot of opening and closing of the incubators, and the controlled environment in the IVF lab will not be so very strictly controlled. I'm not saying that these sort of IVF labs are substandard. However, in a case which is, let us say, not conceiving or has undergone several cycles of IVF and still failed, I would say it would be very good if that embryo is alone cultured in their particular incubator. This is a very good thing to do, so that the baby and that is the IVF embryo gets the utmost care that it can receive. This causes this helps in doing what is called a blast culture on a very frequent basis. That means almost every embryo or every set of babies that a couple produces can be given their best chance to reach the blastocyst stage. So as and when the the woman menstruates, we can begin with their IVF cycle without batching, and making sure that we are giving the utmost care to the embryos of that particular couple, so that they can grow in the best environment, in the safest environment for them. Once we do that, we ensure that the embryology is done in a very dedicated method. At this time, one very important thing that you should realize is, even if you do the best embryo culture, not all embryos will survive up till the blastocyst stage. The reason for that is the inherent genetic issues in the couple. Only the best embryos will reach the blastocyst stage, that is a day 5, day 6 culture. And these embryos are deemed to be the most healthiest embryos and have the highest chance of implantation in that particular couple. So at an average, we can say that every couple who is undergoing something like a moderate stimulation will yield somewhere close to 3 or 2 blastocysts at the end of the IVF cycle. Definitely, if they produce a lot of embryos, let us say 5 blastocysts, it is very nice to freeze them and use some of the blasts for a future cycle in case the couple does not conceive in the present cycle. However, around 2 to 3 average blasts is something that the couple can be assured in case everything goes well in the IVF lab. This is as far as the embryology is concerned. Then let us talk about the embryo transfer process. The embryo transfer process should always be done under vision, that is under ultrasound guidance. You must have seen on various videos that the gynecologist or the IVF specialist inserts a catheter into the endometrial canal, and from there the embryo is injected almost 1 to 2 centimeters, almost 1 to 1.5 centimeters from the fundus of the uterus. This is the most ideal location to inject the embryo, and this is how it is supposed to be done internationally under vision. Doing it under vision, make sure that the doctor is very precise, and back to back we can get very good results of embryo transfer. Since this is a very standard process, I am not going much into the details of it. And followed by that, again we have to do what is called a luteal phase support. Again, due to various trial and errors, various types of luteal supports work in different populations. What works best for me may not work the best for you, so your doctor should know what works best in his or her individual practice. So what we have been using in our center has been giving us consistent very good results since the past several years. So we will be doing our protocol as we have been doing in the past so many years. So along with this is so far I have explained about what we are doing in our IVF practice to support our patients. This is what has been giving us a very good IVF success in most of the cases. Another thing which is very important for me to say is I am very grateful to the IVF team that I am working with. You may be thinking that IVF requires one person and we will be doing it as a one-man show. Definitely this does not work out. The main reason for that is IVF requires several hands at the same time, and it is a very good practice to have a very good team. A team consisting of gynecologists, IVF expert. So in my team I am the one and only IVF expert who works. However, we are having trained gynecologists in the hospital who will be assisting from time to time. There are trained anesthesia persons who are going to make sure that IVF is a completely safe and a painless process. At the same time, we have dedicated embryologists. These are experts who take care of the gametes, that is the eggs and the sperms of the patient, and take care of the proceedings of every case in the embryology department. In our setup, as a policy, as a hospital policy, we make sure that a single embryologist is in charge of a single couple's IVF process. So we will not have one embryologist coming in for the OPU, one coming in for the ICSI and another coming in for the ET, because that is not how we work. Always in such a case when things don't work out, one person tends to blame the other, saying that their work was substandard, whereas we don't allow that sort of a thing. If an embryologist is present for the oocyte pickup, he or she will make sure that they take care of their babies throughout the embryology process, even up till the end result, that is the ET, embryo transfer stage. So this is what has been giving us beautiful results. A very important thing at this time should be that the team should have the same ideology in their heads as what I am thinking, as in the love and the passion that I display for my patients. It is seen in the eyes of all the team members, and their hands will work as per that. This will make sure that we achieve consistent, very good results in almost every IVF attempt that we make. So I hope today's video was educational enough for you to take a step in the correct direction, and I hope you conceive as soon as possible in whatever treatments that you are undergoing. In case you have not yet subscribed to my channel, do consider subscribing. Your every subscription gives us great motivation to produce more and more educational videos which would benefit you or your friends. Do remember to subscribe and like this video. See you in some next video. Until then, have a good day.